Well, forget whether they can fix it. It really comes down to this whole healthcare law and the guy who says you might as well just stick a syringe in it. And he is a doctor, orthopedic surgeon, Dr. Mitchell Brooks, joining me along with Tea Party, Katrina Pierson. And I want to give credit to Katrina. She warned about this years ago. She was only 12 at the time. Amazing. Welcome to both of you. Katrina, you're not surprised by any of these latest developments, right?
Oh, absolutely not, Neil. We knew from the get-go. I mean, the Affordable Care Act does nothing for health care. What it is for health care costs. And if the government wants to control costs, the best thing for them to do is to get out of it, because we all know that a free market is what controls cost. But what we're seeing play out now is the initial fear, because the Obama administration's end game was not to control costs or have control of care. What they want is a one-payer system. This disaster will lead to the one-payer system.
You know, Doctor, you said I don't want to give away secrets. Or before the show started, we were chatting. You mentioned something very revealing, that the president might not have broken any promises. He had a very legalistic way of explaining, if you like your doctor and you like your coverage and you like your plan, you can keep it. What he left out, to your point, was that you would be paying through the nose for it, right?
Correct. But he did say that you will be able to keep it if you so choose.
Where do you think this is going, Doctor?
It's going to a two-tiered system of health care, I think. It's going to a government system for the 70%, 65% of people who can't afford a specialized insurance policy or an insurance policy at all. And then the second tier, which will be physicians who either will not accept any insurance or who by government decree must accept Medicare, but will assign Medicare slots to their schedule like American Airlines assigns frequent flyer miles.
Not generously.
Well, that's up to you.
All right, now, well, I know how that works out. Now, I've known many doctors' offices that are now saying, here, you pay up front, you deal with the insurance or whatever, because we can't, we won't. Is your office the same way?
Yes.
Really? And it's just the hassle factor or the expense factor or both?
Yes.
Yes, yes, yes. All right.
I mean, basically, if you want to see me, you have up to an hour and a half to see me. So you have to make a choice. Your choice is, do you want to have a drive-by visit for 3 to 5 minutes and have the physician's assistant see you and wait? Or if I'm late, you don't pay and you can see me up to an hour and a half. That's a choice. If you take your car in every 3 years and spend $1,500 on it, why wouldn't you, for every 5 years that you have to see an orthopedic surgeon on the average, not pay $400 or $500? It doesn't make sense to me.
Yeah, that's a very good point. Katrina, you know, they're trying to, you know, stop these springing leaks, but they're springing leaks, and now the added crisis with the IRS. We know how they've bungled things, and now we're going to put them in charge of 49 different elements financing this healthcare thing. At the very least, it's got to slow the rollout of this, doesn't it?
I doubt it.
Really? So one way or the other, it goes through?
This administration is moving full speed ahead. They won re-election. They know it. They're going to move forward with it.
And they fear, to Rich Edson's point, that anything they delay risks compromising the law itself.
Well, absolutely, but to the doctor's point, if you look at the average family, I worked in healthcare for 12 years. What's happening in these large facilities, these hospital-based facilities, is there's a new bureaucracy that's implemented to oversee even the physicians. So you're looking at physicians, your average physician is looking at up to a 20% dependency of their salary on the Obamacare.
What you're saying is interesting, though, because to your point, Doctor, and I want to get back to you on this, is far from slowing the momentum for this thing, all these crises, all these questions, the 78-page Nancy Pelosi toolkit, talking points, whatever the heck they call it, this is all their way of saying we got to rush even faster.
Absolutely.
Doctor, what do you think of that?
Well, there are a couple of things. First, let me talk about the exchanges. A couple of weeks ago in Forbes, they did a piece whereby I believe the gentleman's name is Peter Zhao, who is the Chief Information Officer, or the Deputy Chief Information Officer of HHS, who's in charge of implementing the IT for the exchanges, and they asked him how he felt it would go, and he said, well, let's hope it's just not a third world experience. So what we have here is the government rushing to do something and setting the bar and saying healthcare will not be a third world experience. Now, I'm not making this up. This was a quote. And then to your point about hospitals, there's something going on in this country that the public needs to be aware of, and that is that hospitals and insurance companies are buying physicians' practices. Now, when you have the means of production and you buy the actual people who produce, who control the costs, and you turn them into an employee, trust me, they're only going to work 9 to 5, and they're not going to work to the greatest extent of their capacity. And this is the danger. We're taking 200,000 entities and we're boiling them down to about 200 entities with which the government wishes to deal, and they are de facto monopolies in each city, in each area. You have large hospital organizations here in New York City. You've got Columbia Presbyterian in New York Hospital. They've bought their doctors. They've bought their physicians. They come close to the monopoly laws but don't go over the line. And this is the consolidation of health care. And
if you were a young man again, you're a young man now, mind you, but would you enter the profession?
no.
I hear a lot of doctors say that.
I know a lot of doctors who are getting out of the profession. It's really disturbing what's happening, and all of America needs to be aware of it.
All right, well,
And these aren't scare tactics.
No, no,
this
no,
is
no,
really,
you
really
can see
going
it.
on. I want people to understand.
Go to the doctor's office. You'll see it.
We're not saying this.
Yeah.
It's not good. I've practiced in Canada. I've taught in Great Britain, and this is a country of 320 million people that has a knife and gun club. Those countries are relatively peaceful, and they are being rationed to no extent.
Amazing. Dr. Katrina, thank you both very, very much. Actually, I don't thank you at all. It was horrible stuff you shared.